अस्सलाम वालेकुम, मैं हूं डॉक्टर ज़ैनब और आज मैं आपको बताऊंगी कि कौन से इंस्ट्रूमेंट होते हैं जो सी सेक्शन में यूज़ होते हैं, हिस्टेक्टमी में यूज़ होते हैं, गायनी ऑफ के मैक्सिमम इंस्ट्रूमेंट, जिनमें सबसे पहले है ये राइट एंगल डिटेक्टर। ये एब्डोमिनल वॉल को एंटीरियर एब्डोमिनल वॉल के जो सुपरफिशियल सर्फेसेस हैं उनको डिटेक्ट करने के लिए यूज़ होता है। उसके बाद आता है डीवर्स डिटेक्टर, पोस्टीरियर एब्डोमिनल वॉल को पोस्टीरियरली यानी कि गट और उसको पीछे करने के लिए हिस्टेक्टमी में हम इसको यूज़ करते हैं। डीवर डिटेक्टर ये डीप स्ट्रक्चर्स को डिटेक्ट करने के लिए, एब्डोमिनल वॉल को डिटेक्ट करने के लिए यूज़ होता है। फिर आता है डाइन डिटेक्टर, ये एंटीरियर एब्डोमिनल वॉल में जब ब्लैडर को सी सेक्शन के दौरान पीछे करना होता है तो टू रिट्रैक्ट द ब्लैडर डाइन डिटेक्टर यूज़ होता है। दिस इज कॉल्ड सेल्फ रिटेनिंग एंटीरियर एब्डोमिनल वॉल डिटेक्टर and this is used to retract the abdominal wall, self retaining abdominal wall retractor। इसके दो ब्लेड्स होते हैं, जो एक इधर लगा हुआ है, एक इधर लगा हुआ होता है इस तरह से। और उसके बाद आता है ये मायोमा स्क्रू। मायोमा स्क्रू इज यूज्ड टू होल्ड द यूट्रस ड्यूरिंग मायोमेक्टमी एंड ड्यूरिंग हिस्टेक्टमी। मायोमा स्क्रू, दिस इज कॉल्ड मायोमा स्क्रू। Then comes the green armitage. Green armitage is used for hemostasis during C-section to hold the angle of the uterus. Then comes the hysterectomy clamps. These are hysterectomy clamps to hold the angles of the uterus during hysterectomy. This is called the Leahy's forceps to hold the deep arteries and arteries during hysterectomy, like internal artery to hold the internal iliac artery during surgery. This is called Leahy's forceps. Then this is called Coker's forceps to hold the structures and especially arteries. This is called Coker's forceps. Coker's forceps having two tooth. Then comes the retractor, Wrigley's forceps. This is called Wrigley's forceps to deliver the baby during C-section and normal delivery. When the head is large, we use to deliver the baby by holding the head within these two blades. This is called Wrigley's forceps. Then comes the tooth forceps having two tooth on the top, and this is used to hold the skin and tissues during stitching. This is called a plain forceps to hold the peritoneum and the different structures during delivery. This is called curved scissor or surgeon scissor during surgery. It is used for cutting purpose. This is called towel clamp, and this is called sucker nozzle. For suction purpose this is used, and during surgery for cutting purpose this is called BP holder, where we hold the blade over here, and this is called BP handle or BP holder, BP handle. This is kidney tray to hold the sterilized instrument inside the bowl. This is called kidney tray. These are Ellis forceps to hold the structures, tough structures like rectus sheath. These are called as Ellis forceps. This is needle holder. Needle holder is used to hold the needle during stitching. This is sponge holder. Sponge holder is used to remove the placenta and membranes during delivery. This is curved artery forceps. These are two types: straight artery forceps and curved artery forceps to hold the arteries and for the hemostasis purpose. These are called artery forceps. Artery forceps. These are all the instruments that are used mainly in the gynae and obs, and their uses and their sterilization process will be discussed. And I hope so this video will be helpful for you for the exam purpose and for the demonstration of these instruments. Thank you so much. Allah Hafiz.